नमस्ते बिटिया हमेशा खुश रहो बिटिया A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In today's clinical lecture, we are going to discuss about the endocrinal disorders, the physical signs of endocrinal diseases. What are the different signs of endocrinal diseases? Now, there are various signs. Physical signs depend upon the system that is affected in case of endocrinal disease. The physical signs includes the general, what are the different things that we are needed to be done or that are needed to be checked whenever a patient of endocrinal disease is coming to us. In the general features, first of all, look at the appearance, look an external feature of the patient. Then look for the stature, whether he is a short stature, tall stature. Check for any kind of unichoidism, that is, measure the upper and lower body segment and calculate the ratio. Check the weight of the patient, whether it is normal, increased, or decreased. The next is check the temperature of the patient, whether the temperature is normal, high, or low. Check for the pulse rate, that is high or low. Next step is to check for the respiratory rate, the normal and or abnormal, increased or decreased, and what is the rhythm of respiration. Then check for the blood pressure of the patient, lying down or standing, both. So this is the general investigation, appearance, checking the appearance, look and external feature of the patient, checking the stature, the unichoidism, checking for the weight, temperature, pulse rate, respiration rate, and blood pressure. Next, check for the local signs of the patient, checking for the neck swelling, the thyroid enlargement, checking for the note, the size, shape, and temperature, nodularity, tenderness, and bruit. Check for the signs due to the systemic effects, which includes the cardiovascular signs. Look for the posture drop of the blood pressure, signs of autonomic dysfunctions, arrhythmias, irregularity, irregular pulse due to atrial fibrillation or VPCs. Check for the signs of congestive heart failure. In the eyes, look for xanthelasma, corneal calcification band, and keratopathy. Check for proptosis, exophthalmos, unilateral or bilateral. Check for ophthalmoplegia, external, internal, complete. Check for lid retraction, lid latch sign, the failure of furrows on looking up. Then check for the visual acuity or field defect. Check for the fundus examination for retinopathy or optic atrophy. Check the neurological investigation, which includes generalized muscle wasting, proximal myopathy, peripheral neuropathy, carpal tunnel syndrome. Check for the gait abnormalities or ataxias, the tendon reflexes, whether exaggerated, delayed, absent, induration or tetany in the patient with hypocalcemia. In the next step, check for the reproduction and sex, failure of appearance of secondary sexual characters, gynecomastia in males, delayed puberty, or galactorrhea. All these things have been checked for. So we have checked about general signs, local sign, and signs due to the systemic effect. You also have to check for precocious puberty, enlargement of the clitoris in females. In the skin, look for the following things: hirsutism, like abnormal hair growth, thin and sparse hair, skin thickening or thinning, localized or generalized. Check for dry, wet skin, pigmentation, localized, generalized mucous membrane, stria pink and white, Rama erythema, necrobiosis lipoidica, diabeticorum. In the extremities, check for long or short, length, long hand or short hands and feet, spade-like hands, finger clubbing. These all things are seen in the disorders of growth hormone. Short fourth and fifth metacarpals, subcutaneous nodules like xanthomatosis, gangrene of the fingers and toes, ulceration of pressure sores, loss of fingers or toes, edema of the feet, pitting or non-pitting. So this was all about the various things that are needed to be done to be examined while doing the endocrinal examination of the patient. So this was all for today. In the next lecture, we are going to discuss about the investigations of a case of endocrinal disorders. This session was powered by digital version 2.0 Jyotin KP Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture.